If you've been doing Kegel exercises every single day because you were told it's the gold standard for bladder control, I have an uncomfortable truth that your doctor might never have explained to you. For the vast majority of seniors over 60, standard Kegels are completely ineffective, and in many cases, they are actually making your urgency, leakiness, and nighttime bathroom trips much worse. I am Dr. Carl, a urologist with 16 years of practice specializing in pelvic health and bladder function for active seniors. Today, I'm walking you through 8 crucial reasons why Kegels fail after 60, what's actually happening inside your body as you get older, and the simple, proven adjustments you can make starting today so you can enjoy golf, long road trips, and time with your grandkids without constantly worrying about where the nearest restroom is. Pay very close attention to reason number 5 because it involves a daily habit almost everyone over 60 does at home or while running errands that secretly damages your bladder capacity every single day. Before we jump into number 1, I'd love to hear from you. How many times a night are you currently getting up to use the bathroom? And what city or state are you tuning in from? Drop a quick comment down below. I read every single comment, and hearing your stories directly helps shape what I cover in these videos. Let's start with reason number 1. Your pelvic floor muscles might actually be too tight, not too weak. As we age, stress, joint changes, and years of holding in urine cause the pelvic floor muscles to become chronically shortened and tense. This is called a hypertonic pelvic floor. Think of your pelvic floor like a muscle in your arm. If you clench your biceps into a tight fist all day long, that muscle becomes exhausted, stiff, and painful. If you try to do Kegels on a muscle that is already clamped down, you're squeezing a muscle that's already cramping. A tight muscle cannot contract properly when you sneeze, cough, or feel a sudden urge, leading to leaks and intense urgency. Research published in pelvic health journals confirms that a significant portion of seniors presenting with bladder issues actually suffer from overly tight pelvic muscles rather than weak ones. Instead of squeezing, the action step here is to focus on pelvic relaxation. Try spending 5 minutes every evening doing deep diaphragmatic breathing, expanding your belly on the inhale to allow those pelvic muscles to gently stretch and release. Always check with your doctor or a pelvic therapist if you feel pain during any exercise. Reason number 2 is a complete loss of muscle coordination and improper technique. Over 70% of people who attempt Kegels without professional guidance do them completely incorrectly. Instead of pulling the pelvic floor up and in, many seniors accidentally bear down, pushing outward as if having a bowel movement. Imagine trying to lift a heavy box, but instead of pulling it upward, you press down on top of it. Bearing down increases pressure inside your abdomen and physically pushes your bladder downward, stretching out delicate connective tissues. The American Urological Association highlights that unguided pelvic floor exercises frequently reinforce bad motor patterns. Your action step this week is to stop doing blind squeezes. If you want to check your technique, speak with a pelvic floor physical therapist who can use biofeedback to ensure you're lifting inward rather than pushing downward. Reason number 3 involves structural changes in your hips and lower back. As we age, mild arthritis, hip stiffness, or changes in spinal posture shift the tilt of our pelvis. Your pelvic floor muscles attach directly to your pubic bone and tailbone. If your posture slants backward or your hips are locked up, the mechanical leverage of those muscles is compromised. Think of a guitar string attached to a wooden frame. If the frame warps, the string loses its proper tension no matter how hard you pluck it. A review from the Journal of Urology emphasizes that pelvic organ support depends heavily on global posture and hip mobility, not just isolated muscle strength. To address this, your action step is to incorporate gentle daily posture resets, standing up tall, gently opening your chest, and doing light hip mobility movements like gentle seated torso circles. Reason number 4 is the hidden presence of daily bladder irritants that overpower muscle strength. You can have the strongest pelvic floor in the world, but if the fluid entering your bladder is highly acidic or irritating, your bladder wall will spasm uncontrollably. Common culprits include morning coffee, dark teas, artificial sweeteners, citrus juices, and carbonated waters. Imagine trying to hold a door shut while someone on the other side is splashing hot sauce under the crack. Your body's automatic reaction is to flush that irritant out immediately, overriding any voluntary muscle squeeze. Cleveland Clinic studies frequently point out that dietary triggers can mimic or worsen symptoms of overactive bladder. Your action step for this week is to keep a simple 3-day fluid diary. Track what you drink and notice if your urgency spikes an hour after your morning roast or afternoon diet soda. Then try swapping 1 cup for plain, room temperature water. Quick pause right here. If this is connecting the dots for you and helping you understand what's really going on, please take a second to hit that like button. It tells the algorithm to share this video with other seniors who are looking for real answers. And tell me in the comments below, have you ever had a doctor actually explain how to do pelvic exercises, or were you just told to go home and do Kegels? Reason number 5 is the trap of just-in-case peeing. This is the habit of emptying your bladder every time you leave the house, get in the car, or see a restroom, even when you don't feel a real urge. While it feels like a safe play, doing this repeatedly trains your brain and bladder to register fullness at smaller and smaller volumes. It's like setting an alarm clock for 3 in the morning every night. Pretty soon, your body wakes up at 3 whether it needs to or not. Over time, your bladder's functional capacity shrinks, making you feel an intense urge when your bladder is only a quarter full, making Kegels completely irrelevant because the issue is nervous system signaling, not muscle strength. Studies in urological rehabilitation show that bladder retraining is essential for restoring normal capacity. Your action step this week is to wait for a genuine, clear signal from your bladder before visiting the bathroom, gradually expanding the time between visits rather than ducking into the restroom every 30 minutes, just in case. Reason number 6 comes down to hormonal and tissue changes that happen after 60. For women, dropping estrogen levels after menopause cause the lining of the urethra and bladder neck to thin out and lose elasticity. For men, natural prostate enlargement creates mechanical resistance at the bladder outlet. Squeezing a pelvic muscle does not rebuild thin mucosal tissue, nor does it shrink an enlarged prostate. Trying to solve these structural changes with Kegels alone is like trying to fix a squeaky door hinge by painting the front door. It misses the root underlying cause. Comprehensive urological reviews show that local tissue health plays a massive role in maintaining a proper seal. Your action step here is to have a direct conversation with your primary care doctor or urologist about your structural health, discussing whether topical therapies for women or targeted prostate evaluations for men might be appropriate for your situation. Reason number 7 is the timing of common prescription medications, particularly diuretics or blood pressure drugs taken in the morning or evening. Many seniors take fluid pills for heart health or blood pressure, which cause a massive surge of urine production within 2 to 4 hours of taking them. If your bladder is flooded with high volumes of fluid all at once, even a strong pelvic floor will be overwhelmed by the sheer volume and speed of filling. It's like a small storm drain during a sudden flash flood. The infrastructure isn't necessarily broken, it's just temporarily overloaded. Clinical guidelines advise that medication timing drastically influences urinary frequency and night waking. Your action step is never to stop taking your medication, but rather to bring your pill schedule to your pharmacist or doctor during your next Medicare visit to ask if adjusting the time of day you take your diuretic could smooth out your bladder's workload. Reason number 8 is weak, deep core activation and increased abdominal pressure. Your pelvic floor doesn't work in isolation. It works as a team with your deep abdominal muscles and your diaphragm. When you cough, laugh, bend over to pick up a golf ball, or lift a bag of potting soil, pressure inside your belly surges. If your deep core muscles are passive, all that downward force lands squarely on your bladder. Squeezing your pelvic floor without engaging your core is like trying to hold up a heavy roof with a single wooden stick. American College of Physicians guidelines stress the importance of integrated core and pelvic stability for long-term urinary control. Your action step this week is to practice pulling your belly button gently toward your spine whenever you stand up from a chair or prepare to lift something heavy, supporting your bladder from the front. To show you how all of this comes together in real life, let me tell you about a patient of mine named Robert. Robert is a 72-year-old retired civil engineer who spends his winters down in Naples, Florida. He came into my office visibly frustrated. He loved playing golf 3 mornings a week and taking long road trips with his wife to visit their grandchildren, but he was reaching a point where he was terrified to leave the house. For over 2 years, Robert had been doing hundreds of hard Kegels every single day while sitting in his recliner, but his urgency was actually getting worse, and he was getting up 4 times every night. When I examined Robert, his pelvic floor muscles weren't weak at all. They were severely hypertonic, locked in a tight, permanent cramp from constant squeezing and anxiety. On top of that, he was drinking 3 large cups of black coffee every morning before hitting the golf course and peeing just in case at every single hole. We stopped his traditional Kegels immediately. We put him on a daily routine of deep pelvic relaxation breathing, shifted his coffee intake to after his morning walk alongside a large glass of water, and taught him how to engage his deep core when swinging his golf club. Within 3 weeks, his daytime panic urges vanished. By week 6, Robert was getting up just once a night, enjoying full 18-hole rounds of golf without scanning the course for restrooms, and comfortably taking those long road trips to see his grandkids. If you want to start making progress like Robert, here is tonight's plan. 5 concrete, simple steps you can start right away. First, pause all standard repetitive Kegels for the next 2 weeks to give your pelvic floor a chance to reset. Second, spend 5 minutes tonight lying flat in bed practicing deep belly breathing, letting your abdomen and pelvic muscles expand fully as you inhale. Third, eliminate the habit of going to the bathroom just in case before you step out the door, waiting instead for a true physical urge. Fourth, review your fluid intake today and make sure you aren't drinking large amounts of coffee, tea, or soda right before heading out or going to sleep. Fifth, write down a quick note to bring to your next annual physical or Medicare checkup, asking your doctor for a referral to a specialized pelvic physical therapist who can evaluate your muscle tone directly. In my very next video, I'm going to share 3 extremely common foods hiding in your kitchen pantry right now that act as direct chemical irritants to your bladder lining, causing intense urgency and night waking even if you don't drink any liquids before bed. I am Dr. Carl. Stay well, and I'll see you there.